You're listening to the OCD Stories podcast, hosted by me, Stuart Ralph. The OCD Stories is a podcast dedicated to raising awareness and understanding around obsessive-compulsive symptoms. I do this through interviewing inspired therapists, psychologists, and people who have experienced OCD. Welcome to the OCD Stories. And welcome to episode 468 of the podcast. And in this one, I chat with Emily Hemendinger. Emily is Clinical Director of the OCD Program at the University of Colorado Health Outpatient Psychiatry Clinic. And in this one, we discuss OCD and pets. And in particular, we get an update on Emily, the positives of pets on mental health, how pets can trigger people's OCD, how this plays out in various themes of OCD, how vets can play a role in reducing compulsions, exposure and response prevention therapy, and acceptance and commitment therapy, and how they help. And thank you to NoCD for supporting the podcast. NoCD offers effective and convenient therapy available in the US and outside the US. To find out more about NoCD, their therapy plans, if they currently take your insurance, or to download their free app, head to go.treatmyocd.com/the OCD stories, or the link will be in the episode description. Thank you to all of our patrons for supporting our work. To sign up to our Patreon and to check out the other benefits you'll receive as a patron, please see the link in the show notes. So thank you to Emily for her time and covering this topic. I really appreciate it. It's always nice to chat with Emily. And for anyone that is affected by pets, whether they're your pets or anyone else's, I hope this episode helps you. And thank you as always for listening. It means a lot. And without further ado, here is Emily. Welcome back to the podcast, Emily.
So happy to be here.
Yeah, it's great to have you back. And, you did update me a little bit just now, but, an update for everyone. What's been going on?
Yeah, I will give the shorter version. Professionally, like our program, I'm still at the University of Colorado, and our program, we opened our intensive outpatient in March 2024, and that's super exciting because we're the only IOP right now in Colorado that takes OCD IOP that takes Medicaid and several private insurances. So it's super exciting, and we're coming up on a year, and
Amazing.
We have the most wonderful team, and it's just great. We had I think the last time I was on here, I mentioned our fundraising event, Exposure Palooza.
Yeah.
So we had our first one in 2023, and it was, even though it snowed, we still had like 100 people come, and it was so great. And we had our second one in 2024, and even more people showed up because the weather was better. And we're planning our third one for 2026. So all really exciting stuff. Yeah, it's exciting. Yeah.
Yeah. Amazing. Well done. So we're going to talk about OCD and pets today.
Yes.
So I thought I'd just, start with an opening question of how does OCD and pets collide? In what ways is it maybe affect OCD? And it may be good for OCD, or good for the person with OCD, or anything you want to share on that?
Yeah. Well, can I actually start by saying, like, you can just have anxiety about your pets separate from OCD. And so, like, just because you have anxiety about your pets doesn't necessarily mean your OCD has latched on to your pets. Although, as we know, OCD really likes to tackle and hijack the things that we care the most about. And pets are one of those things. But in general, just to start, anxiety around pets is common, right? Because there's so much health uncertainty because they can't talk to us. I mean, like, they can communicate, but they're not, speaking to us in language we can always understand. Finances, that's always an anxiety-provoking thing. Possibility of pets going missing, training, logistics. They have shorter lifespans. These are expected and reasonable. But when it comes to OCD and pets, it's when there's that like urgency, that constant anxiety, that impairment, those common things that show up with OCD, those common feelings of like needing an answer, needing that certainty, or having that compulsion that goes along with it. And there's so many different ways that OCD can interact with pets, from like contamination concerns, harm concerns, health concerns, moral scrupulosity, or even religious scrupulosity concerns. And I can get more into those, but that's more of like a general sense for
Yeah.
sure.
Yeah, we'll absolutely. We'll get into those shortly. Because maybe today, I guess we're going to talk more about the sort of quote unquote negative ways pet ownership can trigger our OCD. But just for a brief amount of time, what are some of the positive things do you think?
Yes.
Just maybe it's more general mental health and owning a pet or
Oh,
looking
yeah.
after a pet.
I mean, and I think this is the thing is there's a lot of stuff out there talking about the positives, and the positives outweigh the negatives for sure. But the negatives are there. And there's a lot of research out there that show in general, pets can be good for your mental health. One, especially, and I'm talking right now about dogs, but this goes for cats too. Like with dogs, there's that exercise component, and we know exercise makes you feel good and helps the endorphins, in your body. But with cats, dogs, birds, any animal, it can be that companion that, especially if you're feeling loneliness, can really like show that unconditional love. And yes, cats can show unconditional love too. I know people have this view of cats being more standoffish, but that's not necessarily true. The research shows that cats and dogs both equally positively impact people's mental health. So it's not just one over the other. It helps with depression, and it helps with physical health too. I mentioned the exercise physical activity piece, but it also helps with, because they can help manage stress. It helps with heart health, as well as sometimes cognitively too, having something to take care of, something in your life that keeps you going can just help you function better. I see it really positively impact some of my folks with depression because it helps them with their activities of daily living, right? I have to get out of bed because I have this thing to take care of. And when we have that motivation, that can be really helpful. Not always.
Mm-hmm.
And for some people, it really does. And again, to just have that companion, it can really help with helping you practice self-compassion and help you practice even my coworker and I actually yesterday were talking about, she has a therapy dog, and we were talking about the different ways we can use her therapy dog in our group setting and individual settings. And we were talking about the self-love piece. We were talking about how dogs especially give you direct feedback, right? Like if you pet a dog and they don't want to be pet, they will let you know. And that's such a good way to practice receiving direct feedback without feeling rejected or hurt. And as well as, communicating with the dog too, and being direct. So there's so many different ways that positively impact people with just general mental health and OCD. I think animals help us be mindful too, and can help us calm down and deactivate. And I personally can say that my dog has helped my mental health immensely. Like he is love of my life. My fiance knows this, but my dog is love of my life for sure.
Yeah. Awesome. Well, yeah, I think, also, animals or like cats and dogs especially, they're such like mindfulness machines because they don't, I think dogs worry probably more than cats do. Cats are just think, what can I kill next? They're hunters, dogs were once upon a time, it's been bred out of them. Anyway, and where am I going with this? And I think that there's they're not worried often about the future. Dogs especially might be worried about the here and now, something that's going on. Cats might be
Yeah.
jumpy because of a loud noise. But generally when they're sitting on your lap or by you, because like last night I was worrying about something to do with work, it was stressing me out, and I was looking down at my cat and was thinking, he does not care about this. This problem
Right.
does not exist to him. And that helped me a little bit to think, why am I stressing about this so much?
I love that. I mean, that's so spot on. And that makes me think of like, I'm the type of person who, as I imagine a lot of your listeners are, who likes to be productive and go, go, go and do a lot of things. And I think our pets can help us slow down too. My dog, he loves to just sit outside. And when he was younger, he would play all the time, like just play by himself. It was so entertaining. Um, but now he just stares and he just like looks around and looks for squirrels and like smells the breeze. And it's like the perfect way to practice mindfulness. And it helps me because sometimes I'll go out there and I'll start to do work. I'm like, you know what? No, I have 15 minutes between sessions. I'm just gonna sit here. I'm gonna smell the breeze. I'm gonna look for squirrels. I'm gonna look around. And I think you're so right. Like there's such a great reminder of to practice being in the here and now.
Yeah, yeah, absolutely. And okay, it's cool, awesome. So yeah, there's all those positive benefits, and I'm sure there's many more we can't think of. I do remember it was probably about 7-8 years ago. I put out a post about like how pets can be really good for our mental health and all of this, and I got quite a few messages of like, well, actually, no, it's really bad for me. It's triggered me, or it's making my life hell. And so I was quite naive, sort of 7-8 years ago, when I put that out, not thinking, of course, it's going to be triggering people's OCD. I wasn't a pet owner at the time. So I guess, yeah, it's worth us going into this topic and talking about this now. And obviously those people that commented no doubt loved their pets. As with any form of OCD, if it's relationship OCD, you usually love your partner, but it's making your life hell, the worry and, you know, your religion, whatever it is. So do you want to go into some of the themes more specifically? Would that be good?
Yeah. And you know, I like, do you mind if I share personally
Yeah, go for it.
throughout? Because I know I've shared before that I on this podcast that I have OCD, and while my OCD is like very well managed, I think for the first time in my life when I had a really, really big resurgence of my OCD was when I got my dog in 2019. And I think that was such a wake up call for me. Like I knew OCD waxed and waned, and you know, there were times when we had to practice more of our skills, and I had smaller moments, but that was the moment that really, really got me. And I think I've experienced a number of themes around my dog, and it's just for anyone who's experiencing it, know that it can feel so isolating because um you know, I think there's still some views in our world of, oh, they're just pets. But no, pets are family members, and they can mean a lot to us. And just like with any other theme, like OCD can attack this
Mm.
as well. So just wanted to put that out there.
Yeah, thanks for adding that. And I think what also comes to my mind is I imagine there's some people with OCD who don't have pets in their home or don't own pets, but other people's pets are the trigger. Maybe it's someone
Yeah.
out, you know, someone out, a friend's pet, or even just when they walk in the park and they see dogs, and you know that affects their OCD. So I guess, yeah, let's try and include those people and the pet owners. And
Oh yeah, definitely. Like I wasn't a pet owner for the longest time, and part of that reason was because of contamination themes, right? So I think like starting there, right? We have our contamination themes around animals, whether it's, you know, just at like disgust around animals, germs, dirtiness, fear of getting sick. And then if you own a pet, it might be fear of getting them sick or concerns around their health. And that might look like, you know, constantly checking your animal for signs of sickness, or one that I hear a lot from folks is like checking pets gums for the like oxygen level to make sure they're getting enough oxygen and things like that. Uh, and so I think like people who have pets and then people who don't have pets are impacted by that one a lot. And maybe people avoid getting pets or think they don't want one because of the contamination piece, right?
Yeah.
Like avoidance is such a key piece in OCD. And I think that might keep people from either having a pet or even engaging, right? Because we have so many animals in our world that might just like come up to you or might interact with you. And you might be like, no, I don't want to be near them because of a number of reasons. But so that's contamination type themes and health related themes. We have things like harm, right? Harm themes, whether it's fear of accidentally harming an animal or your pet, or being negligent or irresponsible, some of those hyper responsibility themes of I'm not being like good enough, I'm not checking this enough. There might be a fear of intentional harm of I'm going to like lose it one day and harm my pet, or maybe I'm a murderer or this terrible person and I want to harm my pet. Maybe I want to sexually abuse my pet. Maybe I am attracted to my pet. What if I touch my pet inappropriately? Those sorts of harm themes. And then, in conjunction with any of these are like themes of religious scrupulosity of what if I'm not a good enough pet owner or I harmed my pet and I'm going to go to hell or some sort of bad place or afterlife, like bad consequences in the afterlife, or morally kind of what if I'm not a good pet owner and I'm not doing right by my pet. And just I think overall with OCD there can be a lot of guilt about leaving pets at home or leaving pets alone and anxiety and people with OCD might tend to have really high levels of empathy and sensitivity. And so feeling so connected to their pet, they might really feel like that kind of core fear would be like, I can't sit with knowing that my pet is alone and possibly scared or, like that's just too overwhelming. Or it might be guilt around any sort of behavioral training. Is this the right type of training? Am I doing such harm to them by scolding them, by setting boundaries with my pet, by, having them not sleep in the bed, having them sleep in the bed, and all the sorts of like what ifs and decision making that go around it. Those are just, I guess, some of the themes and some of the obsessions. I said hyper responsibility, and I think some of that might be like, for vulnerability's sake, I'll share one that has come up for me as like fear of because of the holidays, right? Like fear of leaving the Christmas lights on and then the house burning down and my dog being there and having to think of that. Like that is one that if I was really in the depths of my OCD, I wouldn't leave the house. But because I'm able to work through it and use ERP and use my values, like I know it's important to leave the house during Christmas time and during the holidays and really in general. But I think I covered most of the themes. And I think even if you don't own a pet, you could just going back to that, like you can still have some of these themes and, avoiding animals because you're worried you're going to harm them in some way is a really big one I hear too with my clients.
Yeah, we imagine with OCD, there's infinite themes, right? It could even be, you see someone walking their dog in a park, wherever, and then, maybe the owner's shouting at them or whatever because the dog's, been naughty or something. You might start to worry, oh no, is that dog safe? Is that dog going to be okay? Is it cared for? You could even worry, if you really care about animal rights, obviously that might really trigger you.
Yeah.
And I mean, the whole empathy thing, I get that with my cat. If I have to leave it and no one's home for like 5 hours, I feel guilty and worry about, But I think you did mention it in harm OCD, but I wonder if it's worth highlighting more. Sort of, I guess we could call it like bestiality OCD. Of like, yeah, you said about being attracted to your pet, but I imagine for some they get that real vivid sexual intrusive thoughts.
Yeah. And those physical sensations too.
Yeah.
I have clients I see who experience that, and it's so painful for them because they love their animal so deeply, but because of the OCD, they feel they can't be near them, or because they're getting those physical sensations that we all get, but someone with OCD like is hyper aware, and the more you focus on it, the more intense it feels and the more it happens, just like with our thoughts, right? The more we focus on our thoughts, the more intrusive they become.
Yeah.
But with that kind of like bestiality theme, or even just being attracted to your pet, or what if I touch them inappropriately, it can be even more isolating because people don't want to bring that up. And I think, again, like,
Yeah.
people listening to this know that you're not alone in that, and there are people who experience that. And like your pet, or any animal, like they hold that unconditional love. And I think, some of the ERP I do with some of my clients around that is, you get to snuggle with your dog during session. That's what we're gonna do. And like, that's part of that values-based living, because that's what they ultimately want to do. And
Yeah.
I think that's a particularly painful one for a lot of people.
I agree. Yeah, and do you see, because I mainly work with children and young people, I can't remember what sort of age range you work with. I don't see the whole pet worry or pet obsessions or obsessions around pets. I don't see a great deal, actually. Yeah, I've had it, but it's nowhere near common for me that I hear this, that young kids, I'm not saying this generally, it's just what I see. So I don't know if you see more of that or...
So I work with 13-year-olds and up. I see it, and so I work with like teens, adolescents, and I see it with teens and adolescents. I'm not sure about like younger than that, but I see we have some folks in our clinic right now who they're like 13, 14, and they have fears that they have that one thing I forgot to mention was that magical thinking piece that comes in with the OCD. And if I don't do this, something bad's going to happen to my loved ones, including my pet. And so we have some adolescents with those themes. We have a couple people right now with harm themes too. Like, I'm going to kill my dog, or I'm going to kill this animal. And definitely a lot of contamination stuff too, with adolescents. So I see more of like the guilt of leaving a pet, and some of those like health related concerns of, is my dog okay? Do I need to take them to the vet? I see more of that in like older teens and adults, but contamination and harm and magical thinking, I see more in adolescents. Like, I see in adults too, but that's the one that I more see with adolescents.
Okay, interesting. So let's think about applying therapy to this. So, this is someone's theme, it's around their pet or sort of around someone else's pet. Obviously, it's going to vary greatly, but maybe we start with ERP. What are some of the exposure ideas you're doing, or how do you build up to it? Or...
Yeah. Well, it all comes down to values, right? Like, such an ACT therapist at the end of the day. And I always start with values and reminding people like of the value of that relationship with either animals or their pet. And so, for example, like I said, with like some of the more harm related themes, like snuggling with your dog can be such a good one. And the important piece, because a lot of compulsions might look like reassurance seeking and checking. And so making a plan around those, of reducing those behaviors, or replacing them with especially the researching online too. But yeah, snuggling with your dog, I think sometimes for people with contamination themes, even just petting a cat or interacting with an animal. And then the response prevention is, coming up with a plan to it's not do hand washing, but refrain from hand washing and doing something else, right? Um, and I think sometimes for folks who have more of an issue leaving their animal at home, it might start with, okay, you're going to leave your animal, outside in the backyard for X amount of time without checking on them. Um, it might be starting small and like leaving your pet to go for a walk or go to the store. And then you slowly increase the time. I mean, that's how, when you're doing behavioral training with, and again, I'm using a dog, but, right, like dogs that have separation anxiety, you have to do exposure to therapy with them too. You have to leave them for a short time, just stand outside the door without immediately going back, and you increase the time gradually. And so that's what you're doing too, like you're leaving your pet alone for a short time and then you're working your way up. And you might let someone else watch your pet. You might, if you struggle with being around animals and you don't have a pet, your exposure might be to watch someone else's pet. That might bring up a lot of hyper responsibility and harm related themes. It might be one good one is, this is more response prevention. I think response prevention pieces are like interrupting, reassurance seeking, checking and researching, normalized cleaning, and normalized vet visits are really important too. And I can get more into that in a moment, but of course, imaginal exposures are always a good tool too. Like you're facing your fear by, we're having people imagine as vividly as possible their worst fear coming true. So maybe it's like them not harming a pet, but their pet experiencing something, like a serious illness. And us as the therapist are working with them to help them not engage in the compulsion and learn to accept that the fear and anxiety can be there. You don't have to act on the compulsion. And you can still live a valued life despite those fears being there. Let me think if there are any other ones. Again, yeah, I think with any sort of harm themes, the best exposure is like interacting with an animal. Maybe a big exposure for someone that's also super values based is going and working or volunteering at an animal shelter. Because the things that help us often in recovery from most mental health conditions are service and connection, service to others, connection to others, and service to our values, or service in like our values and connection to our values. So being of help to pets and animals can be both a challenge and super values based.
Yeah. Absolutely. Yeah, I love that. Yeah. Service and connection. I agree. Very important. And I guess obviously, on Zoom, if you're doing sessions on Zoom, the good thing the good thing is that the pet is there in theory.
Yes.
So you can bring the pet into session, do the exposures with them there. And I guess also, unlike something else you're afraid of that is maybe, what's the word for an object that is not alive? Inanimate. Yeah. With an inanimate object you're afraid of in OCD, you're not getting any feedback from that inanimate object. But with your dog, your cat, your guinea pig, your rabbit, your whatever bird, you're getting that feedback. And
yeah, I love it. That's so true. So true.
Yeah. And then do you see clients in person as well still?
Yes.
Cool.
Yeah.
So are they allowed to bring in their pets?
Not at the moment. I would love that, but not at the moment. So sometimes if somebody struggles with leaving their pet at home, like I'll encourage them to come in person. And we'll like work, that will be like our exposure for the day. But I also, when it's appropriate, I do kind of in vivo exposures where I'll meet a client somewhere. And we can do exposures with their pets in that way. I mean, it depends on the pet, I guess, but mostly it's been cats and dogs that
Yeah,
I've done
tiger.
these things with, but yeah, right.
Yeah. Yeah. Okay, cool. Um, yeah. I don't know. I guess what's coming to my head is whether I'm sure there's OCD therapists out there that have also got a therapy dog in their room. I'm sure that
Mhm.
someone out there exists that meets that quota. Whether that's a good, if there is one of those in your area, going to see that OCD therapist with the therapy dog, if that would trigger in any way.
Yeah, I mean, we're about to have one, I hope, in our clinic, and I think it's something that we are getting ready to navigate because there are going to be people who
Yeah.
don't want the dog there, and it's more kind of figuring out, is this OCD like avoidance, or is this genuinely like a preference? Um, and so obviously we're not going to force it on anyone, but I think
Yeah.
there's a lot of benefit in having a therapy animal in any sort of treatment.
Yeah. 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 Absolutely. Okay, so let me think. So, from like an act point of view, is there anything else you want to add um, to this?
Um, well, I guess not acts, but meant to go back to talking about the vet
Oh,
visits,
yes,
and
yeah,
so I can do that if that
hmm
works.
yeah, go for it.
Yeah, so with response prevention and the vet, what I often see with the folks that I work with is either excessive contacting of the vet, excessive vet visits, or avoidance of the vet, right? Because of fears of what might come up, and whatnot, or money even, that might be a concern too. And so my colleagues and I actually, we did a presentation for the local IOCDF Colorado chapter back in 2023, I believe, about OCD and pets. And we had someone who is a vet and who has done like TED Talks on pets and grief and all of that. Uh, and I think we came up with, we kind of were talking about response prevention and how not all vets would be willing to do this, but how you can, if you're willing to work with your vet to come up with a plan. And because everyone deserves a reality check, right? Like,
Mhm.
just seeking information is different than seeking reassurance. So getting kind of a roadmap from your vet, not reassurance, but just basics of like, these are the things to know, and coming up then with a plan with your therapist of, this is what normalized visiting looks like. And, like, this is what normalized having a pet and noticing their health looks like. And
Mm.
so having that initial roadmap from a vet, and also maybe working with your vet to let them know, like, please don't provide me reassurance.
Yeah,
It's hard. It's an extra step, but it can go a long way because ultimately, like, they definitely know when an owner is anxious, right? Because they're
yeah,
getting all of those emails or phone calls, and um,
mm.
some vets will be more likely to provide reassurance. Some might not because they're very busy. They don't have time. But if you're able to work with them and let them know what's going on, a lot of them can actually be really open and willing to work with you on coming up with just like a basic roadmap of what you need to know and what is normalized, like vet kind of visiting.
Yeah, and if they haven't already done that, you could kind of sell it to them of, look, once you've done this with me, you can then turn this into a PDF and give it to all your clients and have it on your website.
Exactly. And that's why when we did that presentation, like, we really wanted to focus on that. And I believe a few of those same colleagues are doing actually a talk soon about um, like how veterinarians can talk to patients about some of their anxieties and such, or concerns, because there are a number of mental health conditions that interact with pet ownership. Um, so I'll be looking forward to that. But um, yeah, I think getting them on board, like especially if your theme is around those sorts of things, it's just like if you have religious scrupulosity, you want to make sure that your spiritual like leader or someone in your community is involved in your treatment. So if your theme is very much around like your pet, having your vet involved is not out of the ordinary.
Yeah. Yeah, absolutely. Yeah, it's just thinking of the vet and making that list or plan or map. That's something I hear so often more generally with my clients of, even if it's say hand washing, they don't know what a normal amount of hand washing is, because where you've done
Right.
something so long and been so anxious for so long, you've lost contact. You can lose contact with, well, what is a normal amount of hand washing?
Yep. I think that's
And
perfect.
yeah, and any OCD compulsion that can happen with. So as you're saying with the vet, I'm completely okay educating clients of, let's figure out what is normative, what the average person does, and use that as your roadmap. And I think that's okay. But obviously, if they keep asking you, then it becomes reassurance.
Right. It's like the one roadmap, and I
Yeah.
think it's going to be different for everyone. So I like my dog. I love him so much, and I got really lucky, and he has been. It's been a challenge from an OCD standpoint because he has lupus. So his just but with on his nose, so his nose gets like scabby and stuff. So he has lupus, and because of the mix of breeds he's like part corgi, so he has a lot of joint issues, and he also very clearly has anxiety.
Mm.
But with the medical problems, it's been something to navigate of, okay, how much of this is me being overly sensitive and how to and hyper aware of these things, and how much of this is like, oh, he actually does have medical problems, and what is the norm for having a dog that has chronic pain and an autoimmune disorder?
Yeah.
Um, which has been a really unique challenge. And I think I'm really grateful because it's really helped me put into practice a lot of skills that I'm constantly talking to my patients about. And yeah, I think having that roadmap, regardless of where your pet is at, because that roadmap might change too if your dog has a condition like that, or when your dog or cat or bird, et cetera, gets older.
Yeah. Yeah. Really, really good point. Okay. So is there anything else you want to mention about animals, pets?
The one thing I think I forgot to mention was some of the death and dying and existential themes that can come up, right? Like just like with humans, it can come up with any animals as well. The unfortunate piece is like I mentioned before, they can't speak to us in a way that we always understand. And so we might not know exactly what's going on. And so when it comes to making end of life decisions, that can be really tricky. There can be a lot of doubt even after you make a decision of, was this the right thing? Is this the right thing? Was it right to not get them treatment? Was it right to get them treatment? Um, and just like that guilt that is so present across the board, guilt and shame with OCD can really be present in this area too. And I think that that core fear or that avoidance of wanting to avoid that really intense grief that might feel super impairing, or like yeah, I would be so overwhelmed I wouldn't be able to function. I think it's so common because
Mm.
pets live shorter lives than us, and it's something that we are going to experience, and it's an unavoidable thing. And
Mm.
I think talking about that and normalizing that with your loved ones, with your therapist is really important.
Yeah, that's a good point. And thinking about that, obviously, with the existential themes, having the pet might not trigger you at all until they pass away, and then that
Right.
triggers the existential worry about death and whatever else.
Yep. And I think like our society has gotten better, but it is one of those um it's one of those types of grief that doesn't always get noticed, like divorce or a miscarriage, right? The death of the pet isn't always recognized as much as other forms of loss. And so I think it's important to note that if your pet is your main form of support and companion, like you have every right to feel those intense feelings of grief. Don't let someone tell you like, oh, they're just a pet, they're just an animal. Don't let them do that. Like they're family members and they feel emotions and they're important to us. So yeah.
Exactly. Yeah, I agree. Awesome. Well, look, you've got a billboard. What do you want written on that billboard?
What did I say? I think last time I said take up space. For the sake of this one, I'm gonna say like pet your dog or like love your animal and spend time outside. I don't know. I think yeah, for the sake of this one, I'll keep it animal themed. Go pet a dog or say hi to your dog for me. But yeah, I think that would be, yeah, I'm going to stay with that one.
Nice. I like it. Well, look, lastly, is there anything else you wish you could have said or shared today?
I think my big thing is just know that like OCD can latch on to this theme and that I think it's one that people like, it might seem like, oh yeah, of course OCD latches onto that, but people don't always talk about it. So whether it's like fear of attraction to your pet or animals or a contamination theme or, whatnot, I think just know that you're not alone in that and that, pets are important parts of our lives and this needs to be talked about.
Yeah, perfect. Well, look, thank you so much for coming on and talking about this important topic. And I've had my cat biting and scratching my foot the entire time. So I
love it. Thank you for having me.
No worries. Thank you for listening to this week's podcast. And thank you to our Patreons who helped make this episode possible. And if you would like to find out more about Patreon and the rewards and benefits, then there will be a link in the episode description. If you enjoy the OCD Stories podcast and would like to support us, please subscribe and rate the show wherever you listen to the podcast. And thank you to NoCD for supporting our work. And if you want to find out more about NoCD, head to go.treatmyocd.com/the OCD Stories or click the link in the episode description. And quick disclaimer, guys, this podcast is not therapy. It is not a replacement for therapy. Please seek treatment from a trained professional. And until we speak, take care.